I'm Dr. Angie Nilsson, Vice President of the Australian Dental Association, and I'm going to talk to our President, Dr. Chris Sanzaro, about compassionate release of superannuation. Thanks for having a little chat today. Hot topic. So we're getting lots of queries and questions from members and patients about CRS. What are we seeing? What is the data saying to us at the moment?
Yeah, look, it's topical at the moment because the Tax Office have just released the last financial year's worth of data, which has shown about a 55% increase in 12 months in the utilisation of the scheme. About $817 million last year was released for dentistry, so some pretty significant amounts of money being directed from superannuation.
So great, more money into dentistry. What's the downside?
The downside is the public perception of it, and also there is a fair bit on social media of questionable advertising of the scheme, things that don't appear to be relevant to the scheme. The scheme's there for the provision of relief of pain, acute or chronic pain, or mental illness issues. That's it. And we're seeing stuff on social media that's going well beyond that.
Do you know what it is as well? It's not just the perception of it. It's that what is the bigger question is that where's the gap? It's actually that people are not able to access affordable dentistry in the timely fashion. And it's acute and chronic pain. It's not about just general dentistry. So, how is this going to be fixed?
Yeah, look, part of it is that scheme has become an important part of the safety net for people that can't afford to access dental care. We know that the public service is underfunded and under-resourced, and there are huge waiting lists across the country, a lot of areas that's growing. And people who can't access care through there, those who aren't eligible for those services but also can't afford to access good care through private dental practices are missing out, and they're using this superannuation scheme to access care because there's a lack of public funding.
There's been some really horrid adverts, super for smile makeover. How can members be guided by the ADA in terms of acting ethically and working with integrity?
Yeah, the ADA website has got member resources on there, a checklist, guidelines, the works. So get those documents, download them, have a read through them, work through them to ensure that you're compliant. We've had the Dental Board look over those as well. There are also some new resources out from both the Tax Office and the Dental Board to assist in this area.
Well, is the ADA talking to the ATO about any of this? Like, is there any guidance from them?
Yeah, absolutely. The legislation's fairly short in how it's written, and it's not very specific. And so there are some areas that are open to interpretation. So to avoid the risk, we're in active dialogue with the Tax Office to try and get some clarification on those areas at the moment.
So do you think we're ever going to get, black and white, this is what you can do, this is what you can't do?
No, it won't be, because by definition, the way it's done of relief of pain, it comes down to professional obligations that we have as professionals, health professionals. Primarily, our patient is our number one priority. We shouldn't be looking after our own business interests or anything first. We're always looking at what does the patient need? What's the legitimate right way to treat this person? How would you feel if it was your mum or your family member that was in the chair and you were receiving this advice?
Yeah, and I know that we've got resources on the members' website for templates and guidelines to help, and I know they're continually being developed, so I'm really looking forward to seeing how those go over time and helping members in future with being able to help patients to access care.
Yeah, certainly we'll update those guidelines and announce if any guidelines are needing to change will be updated through our usual member comms.
Cool, thanks Chris.
Thank you.